Good day, everyone, and thank you for having me. Today's progress report. So let's have a talk about the etiology of adverse pregnancy outcomes, shall we? My name is Dénes Kovács, and I'm a resident at the Obstetrics and Gynecology department of our university. And my mission is to emphasize the importance of prevention and to help improve reproduction rates. My vision is that all people should be able to create a healthy family. I have two specific goals I would like to investigate. One is about the connection of HPV, or Human Papillomavirus infection, and adverse pregnancy outcomes. And the second one is about the effect of caesarean section on preterm delivery in the subsequent pregnancy. So let's have a closer look at my first topic, which is about HPV. We know that HPV is important because of cervical cancer, as we have talked about this in the previous section. And we know this because of German virologist Professor Harald Zurhausen. He actually received the Nobel Prize for it in 2008. And HPV is the most widespread sexually transmitted infection, with an estimated prevalence of maybe 80 or 90% worldwide. And we also know from in vitro studies that HPV can actually inhibit blastocyst formation, endometrial implantation, and can cause apoptosis as well in embryonic cells too. So we also know that from cohort studies that it is associated with a bunch of entities in pregnancy, such as preterm delivery, premature rupture of membranes, and pregnancy loss as well. But the results are conflicting, and therefore we aim to assess the connection between these two entities. So our question was that, are adverse pregnancy outcomes more common with women who are exposed to HPV? Our population was, of course, the pregnant women, and we have compared the infected with the not infected. And the outcomes were the adverse pregnancy outcomes, such as premature rupture of membranes, preterm premature rupture of membranes, preterm delivery, and so on. Our hypothesis was that HPV infection leads to an increase in these APOs. So it would be important to emphasize the importance of prevention. We have conducted a systematic search on the 22nd of September last year. Our search key consisted of two domains. One was about HPV, and the other one is all about the entities, such as preterm delivery. And after duplicate removal, title and abstract selection, and full text selection, we have ended up with 15 fully eligible full text articles. And we have finalized the analyses with the 95% of confidence intervals, and the effect ratio, the effect outcome measure was odds ratio. So this is my first forest plot that I would like to present to you, and this is about HPV and preterm delivery. Our hypothesis was that, of course, preterm delivery is going to be increased among the HPV-infected population, and as you can see, the odds ratio was 1.94, which was clinically relevant and statistically significant outcome. And we have carried out subgroup analysis as well among the high-risk population. And it was more or less the same, just not statistically significant. Our other analysis was about spontaneous abortion and HPV infection. As you can see, that the odds ratio was 0.64, which would translate to HPV being protective against spontaneous abortion, but that of course does not make any sense. So we could not prove any connection between the two entities. The strength of our analysis was that it was a quite comprehensive study with a large sample analysis and a rigorous inclusion-exclusion criteria. But there were, of course, some limitations as well, such as different strains were pulled together with a high heterogeneity among the studies, and also the confounding factors could not be assessed very well because they were not very well defined in the studies. The conclusion is that HPV is associated with preterm delivery, but not with spontaneous abortion. And our implication would be to test more frequently, maybe test pregnant patients as well, and vaccinate before family planning too. Implication for research would be to get the vaccine for more strains and treatment alternative as well, and to have more studies on the effect of vaccination among the pregnant population. So the manuscript status currently is that it is under revision at the Journal of Acta Obstetrica, which is a D1 journal, so it isn't currently at the works. So let's have a closer look at the second topic, which is about the effect of cesarean section and preterm delivery in the subsequent pregnancy. We know that preterm delivery is associated with neurodevelopment impairment, low birth weight, lung dysfunction, and other entities as well, with a global prevalence of 15 million, which is estimated to be at the rate of almost 20%. And we know that cesarean section is also associated with ectopic pregnancy, uterine ruptures, morbidly adherent placenta, and of course preterm delivery as well, but in certain cases. So we would like to gather more evidence on the relationship of prior cesarean section and subsequent preterm delivery. Our clinical question is that does cesarean section performed at any stage of labor cause higher rates of preterm delivery in the subsequent pregnancy? And so we would like to assess it in pregnant women who are either experiencing a C-section or a vaginal delivery in the first pregnancy and who have delivered early in the second pregnancy. Of course, the clinical implication was to help for decision-making in patient care. So these were my two topics, and thank you for your attention.
First of all, congratulations to your presentation. It's a very interesting topic.
Thank you.
My first question, I will have two questions. My first question would be, in your first project, the included studies, they only investigated high-risk serotypes of HPV, or they included low-risk serotypes as well?
So, as you can see in this forest plot, these studies actually included both low-risk and high-risk strains as well. And then we have carried out subgroup analysis that only consisted of studies that included high-risk patients.
Oh, thank you. I just didn't notice that. And the other question for your implication in this project, your implication for practice was to maybe test more frequently, maybe during pregnancy. But if you diagnose HPV, what intervention can you do, or what would be the plan after that?
You can either do immune boost, so just taking vitamin supplementation, and there are also a bunch of topically applicable things such as Colpofix, for example, which can inhibit the replication of the virus. But of course, this is still an ongoing research on what to do with the current HPV infection. The best thing to do is, of course, prevent it, which is in most of the developed countries is already happening in the last 15 years, but not globally.
Thank you.
Congrats to your results. I would like to ask also about the implication of the first study. You recommend the vaccination, and what form it should be? It should be like booster before the pregnancy, because most of the women are already vaccinated during the in the early age for prevention. So, what form this vaccination should take form?
Yes, this is of course true for us, for Hungary, but this is not true globally. So a lot of developing countries, there are no vaccination strategies, and there are a lot of patients who are actually not vaccinated. But I didn't get the second part of your question. Could you repeat that, please?
What I'm trying to basically ask is, if the woman already received vaccination in the early age, does she need a booster in later age, or she is fine?
Okay, so the vaccination is good for 8 strains among the high risk, but not for all the strains, because there are more than 300 strains actually. So I wouldn't suggest it to get vaccination during pregnancy, but it would be just a good thing to do it at the family planning stage.
So did you, for the first project for the HPV infection, did you use a cutoff for the time, or did you consider ever HPV positive as positive, or just at the pregnancy?
No, not only. Thank you for the question. This is a very good question. So the cutoff time for diagnosis of HPV infection was not only during the 9 months of pregnancy, or hopefully 9 months, but in the previous 2-year span as well, because the literature says that HPV infection in 95-97% of the cases usually lasts 2 years, more or less, and therefore we have included those studies.
Yes, that makes sense. Okay.